The brain is one of the largest and most complex organs in the human body. It is made up of more than 100 billion nerves that communicate in trillions of connections called synapses. It is the command center for the human nervous system, receiving signals from the body's sensory organs and outputs information to the muscles.
It is responsible for our thinking and voluntary movements, breathing and sleep, coordination of messages between multiple other brain areas, coordination and balance, problem solving and judgment, and motor function, sensation, handwriting, and body position, memory and hearing, and even our visual processing system. It is protected by our cranium because it is a very important part of our body.
But what if, just what if, something unexpected happens?
Amina, okay ka lang ba? Medyo masakit. Ipacheck mo na yan sa clinic, baka concussion na yan. Kasi nagkakadawa, tapos dito ako mag-sisters. Yes, how can I help you? Ilang araw na po kasi sumasakit yung ulo ko. Hindi po kasi absent. Tapos minsan po, may times po na sobrang sakit talaga ng ulo ko. Tapos kapag po maraming tao sobrang minsan ayaw ko na rin po umakyat.
Oh, I see. That's actually a sign of mild concussion. It can lead to a brain injury if you're not going to drink any medicines, okay? Then I'll just give you some prescription or list of a medicine that you can buy on the pharmacy and just make sure that you're going to drink it, okay?
Uh-oh, that's quite a serious problem Amira has experienced. This is why there's always a constant reminder that we should be careful and do not run down the stairs. For if we fall, it might cause concussion and lead us into traumatic brain injury. Now, let's further explain what traumatic brain injury is.
Traumatic brain injury is an injury occurs when an insult to the brain is severe enough to cause a change in the level of consciousness and or an abnormality in the structure of the brain, impairing cognitive abilities or physical functioning. According to the National Institute of Neurological Disorders and Stroke, traumatic brain injury is a form of acquired brain injury occurs when a sudden trauma causes damage to the brain. Traumatic brain injury can result when the head suddenly and violently hits an object, or when an object pierces the skull and enters brain tissue. Symptoms of a traumatic brain injury can be mild, moderate, or severe, depending on the extent of the damage to the brain. A person with a mild traumatic brain injury may remain conscious or may experience a loss of consciousness for a few seconds or minutes.
Other symptoms of mild TBI include headache, confusion, lightheadedness, dizziness, blurred vision or tired eyes, ringing in the ears, bad taste in the mouth, fatigue or lethargy, a change in sleep patterns, behavioral or mood changes, and trouble with memory, concentration, attention, or thinking. A person with a moderate or severe TBI may show these same symptoms, but may also have a headache that gets worse or does not go away, repeated vomiting or nausea, convulsions or seizures, an inability to awaken from sleep, dilation of one or both pupils of the eyes, slurred speech, weakness or numbness in the extremities, loss of coordination, and increased confusion, restlessness, or agitation.
Types of traumatic brain injury. There are two types of injury that can be sustained by the brain: open head injury and closed head injury. Both can result in severe brain injuries and permanent neurological damage. Open head injury occurs when the head hits or strikes a stationary surface or is hit by a moving object. The force of the impact can result in scalp injuries and skull fractures. Blood clots beneath the surface of the skull and concussions or bruising develop from the force of the impact. This type of injury is usually located at a specific place in the brain. Therefore, the results of the injury will produce very specific problems. Example, there may be a loss of sight or ability to speak. Closed head injury is more widespread. Inertial forces cause the brain to undergo a violent back and forth motion as it bounces off the inside of the skull. Nerve fibers and blood vessels may tear from the violent force. Often this injury involves the brainstem, which connects the larger areas of the brain to the spinal cord. Injury to this area may result in physical, intellectual, emotional, social, and vocational impairments.
Causes of traumatic brain injury. In the general population, more than 50% of traumatic brain injuries are a result of traffic accidents. According to Boyles, 1997, falls are the second leading cause, accounting for more than 20% of the injuries. Firearms result in 12% of the injuries, and sports and recreational activities account for 10%. Alcohol is a factor in 50% of all the cases. The remaining 7% are from causes such as cardiac arrest, strokes, or any loss of oxygen to the brain or anoxia. In young children, abuse is the leading cause of this type of injury. 64% of children under the age of 1 year who are physically abused sustain traumatic brain injuries. Shaking the infant is a very common cause. In children under the age of 5, 50% are injured as a result of falls they have sustained. In school age, children and adolescents, motor vehicle and biking accidents and attempted suicides are the major causes. With the increase in violence, firearms are rapidly becoming a frequent cause of brain injury in children and youth.
Masakit po yung ulo ko. Medyo nahihilo po kasi ako ilang araw na. Tsaka natatakot na po akong umakyat sa hagdan minsan.
Teaching strategies for students with TBI. Find out as much as you can about the child's injury and his or her present needs. Find out more about TBI through the resources and organizations. This can help to identify specific techniques and strategies to support the student educationally. Give the student more time to finish schoolwork and tests. Give directions one step at a time for tasks with many steps. It helps to give the student written directions. Show the student how to perform new tasks. Give examples to go with new ideas and concepts. Have consistent routines. This helps the student know what to expect. If the routine is going to change, let the student know ahead of time. Check to make sure that the student has actually learned the new skill. Give the student lots of opportunities to practice the new skill. Show the student how to use an assignment book and a daily schedule. This helps the student get organized. Reduce distractions.
Therefore, if you have a student who has a TBI, learn to be compassionate and understanding. For if you love the job that you are doing, you'll treat your students equally, for love goes beyond boundaries.